This is Professor Plofskin, and this video is to help you use SimChart for the My Clinical areas. SimChart is available for My Clinicals. There are also case studies in SimChart as well as simulations. Again, this video is for the My Clinicals area. Please take a look at student resources before you begin and watch the student orientation video. There are also additional documents here to answer some of your questions about SimChart for My Clinicals. Once you are ready to begin, find your professor in the corresponding folder. Also make sure you choose the correct AM or PM group. There are two assignments, a Note 1 and a Note 2. The first assignment will be Note 1. You will open up SimChart, enter the date of your clinical, as well as the patient initials. Please select the correct hospital floor. The SimChart is different for a women's health floor as opposed to medical surgical floor. Input the patient's gender as well as their age. You can select a avatar, but you do not have to. Also input the provider initials. It will populate your information and then your credentials, which are student nurse. Please complete the allergies information. There are food, environmental, and drug allergies. In order to input information, click on this and then add an allergy. To complete this assignment, you will also complete the system assessments for a cardiovascular assessment, respiratory assessment, integumentary assessment, as well as a pain assessment. So let's take a look. Please be very thorough and careful as you are documenting, and of course use your critical reasoning skills. If the patient does not have an anchial-brachial test that is performed, do not document it. As you are documenting, please carefully consider all of the following areas and add additional notes as required. We don't want you just checking and clicking through all of the boxes. We really want to assess your thought process and your clinical reasoning, so please provide additional notes as required. Let's take a look at respiratory assessment. And again, there are multiple areas for the respiratory assessment, and you can provide additional notes as well. And then there is the integumentary assessment. Again, please add additional notes as required. Then you will also complete the pain assessment. Again, make sure to save as you go. Another area that you will complete is the discharge planning area. We all know that discharge planning begins upon admission. Therefore, even if your patient is not being discharged in the next day or two, doesn't mean you have to make up information. You should always be discussing this information with your patients and then charting appropriately. And there are again multiple areas here, and then please be sure to assess additional information and additional patient needs. Under the system nursing interventions, you will also complete the cardiovascular area, respiratory, integumentary, as well as pain interventions. Under the basic nursing care information, you will complete all of the following tabs. As you are completing the tabs, again, we really want to see a thorough thought process and a summary of why you selected the following areas and the following interventions. So use ample notes to describe your reasoning. You will also complete an SBAR assessment or an SBAR report. And this is a great area to provide an overview of your patient's diagnosis, patient's history, and pertinent information, and a focus, a current consideration, a primary concern that you have for your patient. You can add this to your SBAR report. And again, here are all the components of the SBAR report, as well as what each component should include. An additional area that you will complete is going to be the vital signs information. As you're completing the information, again, make sure to input the site, whether it's temperature or for pulse. For blood pressure, please add the site as well as the position. And this is very much like an EHR in a clinical setting. So this is excellent practice for you. For oxygenation, of course, there's additional information, and that will populate the area in the graph. Also, please provide intake and output information. Even if your patient is not on I's and O's, you will be there in clinical for either breakfast, lunch, or dinner. So you can still practice both gathering and documenting this information. So again, you can select the type of intake here and then the amount. For fluids, make sure that you select the correct fluid and then again the amount. And then for output, please document the output. If the patient does not have their output measured, you can estimate as precisely as you can, and that will populate the information in the graph. And then also please complete the height and weight information. And then the last portion that you will complete is going to be the patient teaching information. You're going to select the category here. When you select the category, that will populate the other areas. And again, you're not just checking the boxes. We really want to see a thorough summary and rationale. Save all of the information as you're documenting so you do not lose any information. And then when you are done, you can click submit. Once you click submit, you cannot edit the EHR anymore. So make sure you're completely done documenting and then submit this assignment, and then your professor will be able to grade it. Thank you very much.